emergency. This is Rio Grande Credit Union. Slow down. Okay.
When we have to call 911 for an emergency, we've come to expect that the only options for help are the EMTs, the firefighters, and mainly the police. While police are specially trained to handle serious criminal activity, many 911 calls are actually about social issues, such as mental health, wellness checks, or conflicts between neighbors. Defaulting to sending the police to these types of low-level calls undermines public safety by diverting resources away from serious and violent crime, while neglecting the underlying needs that drive people to call 911 in the first place. But it doesn't have to be this way.
So my vision for using police appropriately is for us to get to that space and place where the community feels heard and understood. Those who are called out to help them will help them and will not harm them.
Across the country, cities have begun sending community responder teams to certain 911 calls. Community responders are teams of specially trained civilians who can provide de-escalation, conflict mediation, and connections to services in the community. If the call doesn't require law enforcement, they can send a team of community responders to help people in need.
When we can send this civilian team of a clinician and a paramedic to go talk to that person, make sure that they're okay, but most importantly, ask them, what is it that you need? You tell me how I can help you. We're able to get much better outcomes for that individual than them simply being told to move along and go somewhere else.
To ensure that cities are sending community responders to the right calls, they have to adapt their 911 dispatch systems. Most cities use one of three models to dispatch community responders: a 911 call center-led dispatch, an embedded professional-led dispatch, or an external hotline-led dispatch.
On any given day at Denver 911, we receive roughly 4,000 calls.
The city of Denver, Colorado adopted a 911 call center-led dispatch, which has the original call taker identify a call as appropriate for community responders. They then send a community responder team to the call directly through the same process that dispatches police.
When we started STAR, it was an alternative to dispatching police, but police was still very much the default. And what we are working on is changing that.
Responding to page at 5015 South IH35, ETA is going to be 25 minutes.
Or in Austin, Texas, who uses an embedded professional-led dispatch, they have specially trained professionals working inside their 911 call center. The call taker forwards an eligible call to the embedded professional, who can often resolve matters over the phone or decide when community responders should be dispatched.
Stay on the line, I'll tell you exactly what to do next.
The City of Atlanta gets behind a nonprofit organization aimed at policing alternatives to keep people out of jail.
The external hotline-led dispatch, like the one in Atlanta, is when 911 call takers transfer calls to an external hotline like 311 or 988, who can then dispatch community responders themselves. These separate call centers can handle the transferred calls from 911 over the phone and dispatch a team of community responders when needed.
We are the first city in the country to be able to dispatch a non-police response directly from a non-emergency city line. Also, our referral coordination team, who is largely responsible for coordinating the actual triage and communicating with community members after the call.
Cities nationwide have the opportunity to cement the role of community responders in our public safety ecosystem, and getting dispatch right is critical to achieving that goal.
The community knows what they need. They can tell us what they need, and then we can respond to that. We brought all the systems and partners to the table from the gate. So we didn't tell people what we needed or wanted from them. We listened to the experts in their area about what we needed to do and how we could most effectively do it.
My hope is that community-based response programs will be the first option rather than just a nice alternative.
I am hungry. My family is homeless. We don't have what we need. If we can start to get at some of those things again that go to the root, we'll start to see things change and turn around.